Dr. Tan Wu Meng.
Question 12.
Mr. Deputy Speaker, sir, good morning. Employers may choose to provide health insurance to their employees as an employee benefit. There is currently no statutory requirement for employers to do so. Where such benefits are contractual, any changes should be agreed by both parties. Tripartite partners recommend that for employers who wish to provide medical benefits to their employees, that they could adopt the Portable Medical Benefits Scheme, or PMBS, and provide additional contributions to the employees' MediSave accounts instead of insurance. These additional contributions can then be used by employees to purchase their own insurance plans. The PMBS, the Portable Medical Benefits Scheme, makes healthcare costs more predictable and more sustainable for employers. And as the scheme name suggests, employees can also enjoy portability of medical benefits where coverage continues with no risk of exclusions, even if their employment situation changes. Regardless of coverage under employer-provided healthcare insurance, all Singapore citizens and permanent residents are covered under MediShield Life. MediShield Life provides lifetime protection against large hospitalization bills and selected costly outpatient treatments such as dialysis and chemotherapy without exclusions for pre-existing conditions. Singaporeans who face difficulties in paying for their remaining medical bills after government subsidies, after insurance and MediSave can approach medical social workers at public healthcare institutions for further assistance. Thank you.
Dr. Tan.
Thank you, Dr. Tan See Leng, for the reply. I would like to ask two supplementary questions. One is, there's some confusion on the ground among friends, lay people, and even some doctors between insurance plans for Shield plan versus employee benefit types of plans. So is there a way to better educate our people on what exactly these different insurance covers are? My second question is, as the MHIC is reviewing problems with the Shield plan providers and doctors, will there also be a way to re-look how third-party administrators of employee benefit plans could be better regulated? Thank you.
I thank Dr. Tan Yaswam for her questions. I think indeed education is going to be key in terms of how we advise our employees to navigate between the insurance plans as well as the Shield plans. And I believe that is something that we can look into under the auspices of Manpower. However, we should be working with the tripartite partners, namely the labour movement, together with the National Employers Federation, ourselves, and perhaps even bringing in Ministry of Health to work together to collectively come up with very clear communication and educational principles and discussions groups so that we can communicate some of these policies fairly clearly and effectively. Now, on your plans to look at third-party administrators, again, I think this cannot be just isolated to one or two ministries, because the third-party administrators have been in existence for quite a number of decades now. I think to work collectively to make sure that we find a more nuanced approach involves even the trade associations, and in this particular setting itself, we need to involve professional associations, for instance, like the Singapore Medical Association. And if you want to even extend it to the primary care network, probably the College of Family Physicians, and perhaps the Academy as well, to get them involved in coming up with a more nuanced and middle of the path kind of approach involving the providers, involving the third-party administrators, involving the payers, and also the patients who are ultimately the end user of the entire system itself. So it's not something that we can decide in one sitting. Perhaps it is something that the industry should come together and work towards. Thank you.
Mr. Melvin Yong.
Thank you, Mr. Deputy Speaker. I thank the Minister for the answers. There are workers whose employer medical benefits come from an insurer. In some instances, the employer's insurer changed, and the new insurer no longer covered what the old insurer would cover. And then for employees who are so affected, how can they get help? Often they do not know until they submit a claim, and they found that the terms and conditions have changed. Beyond PMBS, which the Minister has cited, are there other best practice recommendations which TAFEP, MOH, and MAS can work on so that the insurance industry can have more consistent practice, including providing avenues for workers to get help? The NTUC would be happy to work with MOM and SNAF to promulgate these best practices.
Minister Tan.
I thank Mr. Yong for his very pertinent question. I think it's important to note that today, as I've shared in my earlier reply, my PQ reply, is that there's no requirement for employers today to do so. However, TADEM can step in to offer advice through, for instance, if the labour movement has collective agreements signed between the employees whom they represent and the employer. We certainly can step in to see how we can actually bring the parties together. But today, there is no legal requirement for them to do so. We obviously aspire that employers continue to take a very enlightened, engaging approach in terms of dealing with the medical benefits and the coverage for all of their employees, particularly when it comes to collective agreements. And we hope that, that all parties will come together. But we understand the challenges because of the fact that we are also in a situation whereby the cost of healthcare continues to increase, and hence the government, on our part, has a slew of different initiatives to help our local Singapore citizens and the permanent residents. But we're happy to work with the union, looking at some of these collective agreements to see how we can step in to advise and bring both parties to a middle ground. I hope that answers your question. Thank you.